examination of swelling in front of neck. At first place, why do we examine the neck of a patient? Establish a diagnosis, differentials, or what is diagnosis and what are differentials? What can swelling in front of neck? Goitre or thyroid swellings or extrathyroidal swellings. First, you have to separate two things. One, meaning goitre or extrathyroid swellings. How will you do that? By doing one test, which is that swallowing. By swallowing, you will differentiate goitre from rest of the swellings. If you have diagnosed it, then what else information you want to retrieve by examination of the patient? One, is it nodular or diffuse? Nodular or diffuse. Make correct comparison. Nodular or diffuse. Number two, toxic or simple. Number two, toxic or simple. Number three, extent of goitre, whether there is retrosternal extension or not. Number four, what is the diagnosis of a lump? Broader classification of lump. Benign and malignant. So the next question is benign, whether this goiter is benign or malignant. So how many questions you have answered by examination? One. Repeat. Is it thyroid or not? If it is thyroid, number one. Is it diffuse or nodular? Number two. Is it simple or toxic? Number three. Extent is whether there is retrosternal extension or not. Number four, benign or malignant. Okay, how will you do that? So you have diagnosed that this lump is a goiter by asking the patient to swallow. If the lump is moving, it's swallowing, that is a goiter. Now you have to examine rest of the things. And examination starts with ICE, introduction, consent, exposure. And number four thing in examining the goiter is positioning of the patient. Positioning of the patient in such a way that there should be some space behind the patient so that you can go behind the patient and examine from behind. Position, be at the level of the patient. If there is no chair, kneel down or sit down. Okay, if there is a stool, you can sit. अस्सलाम वालेकुम, मेरा नाम डॉक्टर तीक है. आपके गले का मुआयना करना है, आपकी इजाज़त है? ठीक है. इंट्रोडक्शन, कॉन्सेप्ट, एक्सपोजर. क्या आप अपना ये दुपट्टा नीचे कर सकते हैं? बहुत शुक्रिया. ठीक. And position, patient is already positioned. Okay. And now I know that I have to examine three things in the neck. And let's see what are those three of water. You should have a glass of water. ये पीने वाला पानी है. इसका एक बड़ा सा घूंट आपने भरना है, लेकिन निगलना नहीं है. मैं जब कहूँगा तब निगलेंगे. रखें. आप निकलें. ठीक है. बांध बाहर निकालें. अंदर करें. फिर बाहर निकालें. ठीक. दोनों हाथ ऐसे ऊपर ले जाएं, कानों के साथ बाजू लगानी है. So Pemberton sign for 10 seconds. नीचे कर ले. Two questions have been answered by doing swallowing. One, that it is a goiter. Number two, by protrusion of tongue, that is this thyroglossal cyst. And number three, by doing Pemberton sign, you have ruled out retrosternal extension, because retrosternal goiter, by doing this maneuver of raising the arms, further narrows thoracic outlet. Right? and when it becomes narrow, the venous drainage of head and neck is occluded, and the face become congested. So 3 tests in the neck. Which one? Swallowing, tongue protrusion, palpation. Now 3 tests in the hand. आप दिखाइए जरा. Palm are sweating. Then ठीक. And number 3rd thing is tremors. दोनों हाथ ऐसे करें और उंगलियां खोलें और उंगलियों के लेवल पे जाके देखें. और if there are certain tremors, you should have piece of paper 1 inch by 2 inch. You place this paper on the hands. Fan should be off, and you watch for it. So there are fine tremors in both hands. नीचे कर. Examination from the back is palpation, and palpation starts with 3 T's: temperature, tenderness, breathing. So tenderness. इसमें दर्द तो नहीं है? ठीक. I'm looking at the face of the patient while palpating it. So there's no tenderness. Number 2, temperature. Temperature first normal skin, then on the lump. So it is similar to normal skin. Number 3, skin. Now examine the lump. ठीक है? ऐसे रखेंगे अपन. Press on one side, make the lump prominent on other side. Checking for features of the lump. When you place the palm of your hand on lump, ये lump prominent हुआ. You put the hand on lump, and what information you can get is it soft or hard or firm? Is it smooth or nodular? Is it pulsatile or not? So this information you are getting, and when you go a little lateral, you can feel its margins, its extent. So it extent, and important is its lower extent, retrosternal or retroclavicular. So this is clavicle, this is clavicle, this is sternum. You place your finger like this, and can you help her to have a sip of water? And you भरे. अच्छा, अभी निकलना नहीं है. अब निकले. So when she swallows, Goitre moves upward. Your finger insinuate. It goes deep. If it means that the Goitre was behind the clavicular sternum. If you can feel the Goitre here and it moves upward on swallowing and your finger goes down, it means there is retrosternal extension. If you can feel that Goitre is above the clavicle or sternum, it is not retrosternal. You can check extension by doing the important features in examination of thyroid lump itself. Now you have to go a little lateral to the lump, and lateral to the lump is, first thing is carotids. In malignant Goitre, carotid is engulfed and encroached by tumor, and it's not palpable. That is called Berry sign. Impalpable carotid vessel due to malignancy is called Berry sign positive. And you examine the carotids one at a time. And where do you examine? The landmarks are more important. At the level of thyroid cartilage, anterior to the border of sternocleidomastoid, you feel carotids. One time, and secondly on the other side. So both the carotids are palpable. What else is relevant to Goitre in the neck is lymph nodes. Okay? Submental, submandibular, preauricular, postauricular, occipital, upper cervical chain, middle cervical chain, lower cervical chain, कंधे उचका, ठीक है, and supraclavicular, ठीक है. So this is lymph node survey. Large Goitre leads to tracheomalacia, and tracheomalacia leads to stridor. So, how to check latent stridor? Latent means it's not manifest yet, but it may develop later on. That is checked by a sign called Coker's sign, and Coker's sign is you turn the patient up. इस तरफ देखें, इधर मेरे हाथ की तरफ. You turn the patient's head towards one side and press the neck towards opposite side. Push it. लंबा सांस लें. Breathe deeply and you listen for stridor, bringing your ears close to the neck. फिर लंबा सांस लें. लंबा सांस लें. This is Coker's. What have you examined in the neck? Lump and some extra thyroid tests in the neck, like lymph nodes, berry sign, Coker's sign. तीन चीजें होंगी. ठीक. Now, being on the back of the patient, eye signs you have to examine. ऊपर देखिए जबान छत पे और ऊपर. So you make the patient look upward such that your gaze, superciliary ridge and maxilla of the patient are in one line, right? And if cornea is in front of this line, it means patient has exophthalmos, right? This is Vascular method of checking for exophthalmos. ठीक है, easy. Proximal myopathy. यानी आपके कंधे नीचे दबाने, आपने ऐसे ऊपर करना, ठीक है? ऊपर करें, ठीक. अब मैंने आपके कंधे अंदर दबाने, आपने ऐसे खोलने. बाहर खोले, जोर लगाएं, ठीक. फिर ऊपर करें. So this is checking for examination of eye signs. Right? The first sign to appear in thyrotoxicosis is lid lag. फिर इस उंगली को देखते रहना, सर नहीं हिलाना. You repeatedly move it, lid lag, a lid lags behind the other. Then myopathy of extraocular muscles can lead to what? We know synchronized movements of both the eyes, and what will happen? Double vision, diplopia. So by doing this doesn't serve any purpose. Ask the patient to tell if having double vision or not. आपको दो नजर आए, ठीक है, तो आपने बताना मुझे. सर नहीं हिलाना, उंगली के साथ आंखें चलानी है. कहीं दो नजर आए तो आपने बताना है, ठीक है. So this is checking for extraocular muscles. इस उंगली को देखते रहें, आप मेरी उंगली को देखते रहिए, ठीक है. So the eyes are converging with the movements of the eye. So when there is loss of convergence, then there is extraocular muscle weakness. That sign is called Mobius sign. So Mobius sign is presence of loss of convergence. Palpating the centrality of the trachea by placing two fingers on sternoclavicular joints and palpating the tracheal ring with middle finger. Next, you have to confirm your finding of retrosternal extension, which you checked on palpation, no percussion. So you percuss, placing one finger above the clavicle. How is the percussion note? Dull or resonant?
Resonant.
It's well resonant. So it means there is no retrosternal solid mass which should have caused dull sound, dull percussion note. Auscultation. You auscultate for two things: thyroid bruit and precardium. Why precardium? Because toxicity can lead to atrial fibrillation, tachycardia. So you check it and place on the upper pole of thyroid. Then precardium. pre-tibial mixed edema. तो अगर पाँव आगे कर लें, 5 ऊपर करें, और ऊपर कर लें, और ऊपर कर लें, ठीक है? And you look for the filling of this hollow, this subcutaneous, ये जो subcutaneous hollow है ना, ये ठीक है? It is filled by gags. What are gags? Glycosaminoglycans, and there is no hollow, and that is called pre-tibial mixed edema. It is a sign of inspection. The last thing you have to do is to do ankle jerk. इसको ढीला छोड़े, पाँव को बिल्कुल ढीला छोड़ दें. Right? फील हुआ? यो बहुत बहुत शुक्रिया आपका, थैंक यू.